Today I'm going to talk about the difference between counseling and psychotherapy. I will refer, as far as regulations go, to Ontario regulations because that is where I practice from. And just a note, in Canada, each province has its own regulations, different titles, and some provinces don't have a regulatory body. So it's not a registered psychotherapist throughout Canada, but in Ontario, it is. That being said, that's as far as regulation goes. There is a distinct difference between counseling and psychotherapy, and that would be more universal. So I will refer to that as well, which is what I'm going to do right now. Counseling is more shorter term and it's present focused. So it'd be more about tackling current situations, specific life challenges, specific issues that people are experiencing. And counseling deals with offering advice, specific strategies, helping a client work through present situations, states of being, emotions. And a counselor will help an individual with certain coping strategies to work through a situation. So some of the things might be relationship difficulties, work issues, stress management, that kind of thing. And some anxiety as well, just not diagnosable per se. Okay. Psychotherapy, in contrast, is more longer term and we dive deep into issues. It's not present focused, although it may start present focused, we try to find underlying issues. So we dig into the past more so. And we really dig into people's emotional state, causes of emotions, like I've said in previous videos, like the narrative that we have created throughout our lives. And we also really look at patterns of behavior. So there's more assessment and diagnostics in it. A psychotherapist can't diagnose, but what I mean by that is we look more into the symptomatology and that kind of thing. So with that, it's more introspective. And we will dig into past experiences, past events, upbringing. We usually tend to look at the catalyst or the root of things. So it's more intense. It's more longer term. It's more diagnostic, as I said, not diagnosing, but looking at symptomatology, looking at digging deep into a person's emotion, their state, causes, that kind of thing. A psychotherapist, regardless of the treatment approach, yes, cognitive behavior therapy is more thoughts, feelings, actions, but we usually, regardless of the approach, we usually try to look at thoughts, how somebody's thoughts create their narrative, their behavior, different emotions, and how that might be changing perspectives, perceptions, that sort of thing. In counseling and psychotherapy, both of them are about change. I think that it's a little bit different in the change, whereas a psychotherapist does not give advice. Counselors can give advice. We are very careful, psychotherapists. Now we have at Dalgety Counselling and Psychotherapy, we can give advice because we switch, but the psychotherapy part of it, I will never tell a client what to do. I will help them figure things out on their own and move through something. So I will pull out things. It's not just about the open-ended questions and the paraphrasing, and although that is part of it, but I will teach strategies and I will help them become their own therapist. So it's digging deeper, it's finding cores. I've said that a few times, but that's what it is. So in Ontario, counselors can come from different educational backgrounds. They don't have to have a master's, a graduate degree. They can come from, psychology, social work, counseling backgrounds. They are not regulated by a college, a regulatory body. They can be members of associations like the Ontario Association of Mental Health Professionals. So can psychotherapists, because I am, or the Canadian Counselling and Psychotherapy Association, the CCPA. So they can be members of those associations, which still regulate, they still have standards of practice and ethics. It's just not a regulatory body that can remove a license. It's not a licensed, registered position. In Ontario, counselors are not permitted to practice the scope of psychotherapy, which is a regulated health act in Ontario. Only registered psychotherapists and other regulatory bodies that I'm going to list are able to practice the scope of psychotherapy legally, and counselors don't fit into that. Psychotherapists in Ontario must be regulated, must be registered with the College of Registered Psychotherapists of Ontario, a regulatory body that provides our practicing licenses. You cannot be a registered psychotherapist without this regulatory body or the other ones I'm about to speak about. What the College of Registered Psychotherapists of Ontario, the CRPO, what they do is they ensure that we have a certain educational criteria. You have to have a master's unless you were grandparented when they first opened up. So people that met certain criteria did not have to have a master's at that time to be regulated. Now, that only lasted for, I think, a year and a half. Now you must meet the educational requirements in order to practice psychotherapy. Also, with the regulatory body, with the CRPO, we have to, every 2 years, we have to show that we have participated in training in professional development, and there's an exam when you first become registered that you have to complete and pass. And then every 2 years, we have to update any extracurricular stuff that we did, any professional development. We have to remain current in mental health trends and educating ourselves. And we have to prove that. Also, every 5 years, we have a quality assurance. I just completed mine. It took me like 4 hours, which is a case-based assessment, a case-based study, 30 different cases. And we have to, they're all regarding the standards, practice, policy, practice standards, and the ethics. And we have to associate the different practices with the case and rank them. Anyway, that doesn't matter, but that is something that we have to do. Also, with psychotherapy, that differs than counseling is we have to have extensive supervision before we can remove our qualifying. So when you first register with the College of Psychotherapists, you become a qualifying member. You have to reach so many direct client contact hours and supervision hours, like 100 or something. And if you think, that takes a few years to do, can take a few years to do. And then you write your exam. Well, you can write your exam before the 100 supervision hours, but you write your exam. Once you have finished the exam, completed your supervision hours and your direct client contact hours, you can become a full registered psychotherapist. You have to meet more direct contact hours and more supervision hours before you can become an independent practice. I am an independent practice. And when you become a registered psychotherapist, independent practice, then you can become a clinical supervisor. But first you have to take a course in clinical supervision and show that you did this 30 hours of training in clinical supervision. Then you can become a clinical supervisor. I'm a clinical supervisor. There is a lot of differences in regulation between being a psychotherapist and a counselor, and proving, we are monitored, we have to prove, and we are held accountable. There are other regulatory bodies that are regulated to provide psychotherapy, practice the scope of psychotherapy. Counselor is not one because it's not part of a regulatory body. Coaches are not because they're not part of regulatory body. The 5 colleges or 5 professions that can provide the scope of psychotherapy are obviously the College of Registered Psychotherapists of Ontario, the College of Nurses of Ontario, the College of Occupational Therapists of Ontario, College of Physicians and Surgeons of Ontario, College of Psychologists of Ontario, and the Ontario College of Social Workers and Social Service Workers. They can all provide the scope of psychotherapy and call themselves psychotherapists as well, not registered psychotherapists. There are psychotherapy tools in the public domain, meaning anyone can use, cognitive behavior therapy tools. Anyone can challenge thoughts and do different programs. Like for children, there's one called Friends for Life, which is a childhood CBT technique or program. I used to do it when I worked in schools, and I wasn't a registered psychotherapist at the time, but I didn't call it psychotherapy. So in the public domain, there are different strategies that you can use, but you cannot treat and do treatment plans and call yourself a psychotherapist or say that you are performing psychotherapy. So I'm going to read, because I can't remember what the scope says, what psychotherapy is, and this will really explain the difference between counseling and psychotherapy and why you have to be registered to do it or trained to do it. So the Controlled Act, Regulated Act, Health Act states that psychotherapy or what we can do, treating by means of psychotherapy technique delivered through a therapeutic relationship, an individual's serious disorder of thought, cognition, mood, emotional regulation, perception, or memory that may seriously impair the individual's judgment, insight, behavior, communication, or social functioning. That is the scope of psychotherapy, and that is why we have to be regulated and have the education. So now I'm going to talk about different approaches and techniques and how they differ. Counselors can use cognitive behavior therapy, but not in the means that I had just talked about, with the serious disorder of thought, emotion, emotional regulations, perceptions, digging deep, that kind of thing. So a counselor can use cognitive behavior therapy to challenge somebody's thoughts. If they are fighting with their spouse all the time, and you can get in there and say, okay, but how did you perceive that situation? Like, you are able to do that as a counselor, again, not digging deep like we do. So some of the common methods that counselors use are CBT, cognitive behavior therapy, solution focused. So that's about working together to find a solution, problem solving, person-centered therapy. So let's get the person into this and where they see things and have them as the center of it. Usually counseling, all of the approaches that they do is more goal oriented. So is psychotherapy, but it's like setting goals, developing problem-solving skills, and fostering resilience, as opposed to psychotherapy. So we use a number of therapeutic techniques. My practice, we use mainly cognitive behavior therapy or different terms within cognitive behavior therapy, not terms, approaches, like dialectical behavioral therapy, mindfulness-based cognitive therapy. We do a lot of different approaches. However, and eye movement desensitization and reprocessing, which is EMDR, which is for trauma. That's what I use because I'm a trauma specialist. There's also narrative therapy. There's acceptance and commitment therapy. There's psychodynamic. There's a number of approaches that are kind of like leaving my brain right now, but positive psychology, there's a number of different approaches. Psychodynamic theory isn't one that we use. However, psychodynamic theory, that's when we explore unconscious processes. Think Freud and that kind of thing. Past experiences. Cognitive behavior therapy is when we identify thought, feeling, action, connection, and we challenge some of them. We create alternative thoughts, emotions. Humanistic approach, that emphasizes self-exploration, personal growth, okay? There's also existential therapies that we can look at. So psychotherapy, like we do, might incorporate, specialized like DBT or EMDR, but often we combine them too, depending on the client's needs. We have a treatment plan. We have a case conceptualization. We make connections to different events. We use different approaches and tools to reshape a person's perceptions. So again, more digging deeper and with more complex needs, disorders, and illnesses, mental illnesses. Settings and accessibility. Counseling is often more accessible in Ontario, might have less wait times because it's shorter in duration. It can be provided in various areas like community centers and schools and hospitals, and sometimes workplaces have counselors involved. Family health teams in this area are psychotherapists or social workers. Counselors can also offer EAP, employee assistance programs, through employee health insurance, and they can work for nonprofit organizations. The cost of counseling can vary. Some services might be covered under insurances, but not usually for counseling because they're not regulated. And sometimes counselors will use a sliding scale based on income. Psychotherapy is typically offered in private practice, like I have, clinics, family health teams, hospitals. It's also offered in not-for-profit. It's also offered in government-funded programs. Because psychotherapy is longer term, it's not as accessible all the time. It does cost more than counseling does, and that is, different education, regulatory bodies, expertise, that sort of thing. In Ontario, psychotherapists are covered by most employee health plans. When I first started in 2016, 2017, beginning of 2017, that wasn't the case because the College of Psychotherapists was only started in 2015. So that changed. Now that it's more recognized and it's regulated, it is covered by most employee benefits. In order to choose the right support, I get asked, how do I know? What do I need? Do I need counseling? Do I need psychotherapy? Really think about what the need is, okay? How complex is the situation? Does this feel like you're in this distress that you need some deep treatment? What issue are you coming? Is it a specific issue? Is it a mental illness? Is it a mental health disorder? Anxiety, depression, bipolar, personality disorders, relationship issues as well, stress as well. Often what happens is people come in saying, I'm having problems with my spouse. And then when we start to dig into it, it's much more complex than that. And it comes from childhood and the messages that we received and abuse or trauma or whatever it happens to be. And we have to dig deeper. So that's, I'm not dissing counselors by any means. I'm just saying that is where, coming to a psychotherapist, when we get into that, then we can dig into it. Whereas a counselor may not be able to do that and may have to refer out, which is also a possibility, and that's okay too. I think we also have to look at the duration, like how much time do you have to give to the treatment? If it's just something like, I'm struggling with my spouse and I can't, or my kids, and I just need some advice, and counseling is perfect. If it's like, this is something big and I think I'm going to be divorced soon, and I think that, or this is stemming from my childhood, I don't trust anyone, it's going to be longer term, and you may want to look at a psychotherapist. How deep is the issue? What is the specific issue? Is it something that you can problem solve with, or is it something that you need formal treatment with? Those are questions to ask yourself. Also, to look at the professional credentials. As I had already noted, the different education credentials, regulatory bodies, and skills that psychotherapists differ from counselors. Also, whether it's a psychotherapist or a counselor, the therapeutic relationship accounts for the majority of the treatment approach. If you don't feel comfortable with your psychotherapist, if there's like that, then you want to find someone that you really relate to. And I can tell you from experience, it hasn't happened often in my career. It's happened a couple of times where I felt it too. I was like, this person isn't a match. They don't like my approach, or they'd had a psychologist for forever or a psychotherapist forever, and that person retired and they're not feeling it with me. That's okay. You're not going to hurt my feelings. In our office, I'm older than my staff, and sometimes young people, they want someone in their early 20s. My feelings are not hurt if you move to somebody else in my office or to another psychotherapist, or if you say, I think I just need counseling, I don't think I need psychotherapy. My feelings will not be hurt. Most psychotherapists' feelings or counselors' feelings are not going to be hurt because our goal is for you to feel better. So I often have clients say, I went to another therapist for a little bit because you had a long wait list and I'm really sorry. And I'm like, don't apologize. You needed the help and I had a long wait list. You need to do what's best for you. You need to see a therapist that is best for you, and don't worry about us, okay? If I have an issue because you don't find a connection, or if you feel you need to be with someone else, that's my issue. And I shouldn't have an issue with that, but that's my issue and my own insecurities or whatever it may be. That is not on you. Okay, so I hope this is a long video. I'm trying to do some more educational videos on YouTube. So this will only be on YouTube, but just some ideas, the differences of counseling and psychotherapy in Ontario. Basically, it is expertise, regulation, scope of practice, and approach. Whether it's counseling or psychotherapy, you need to do you, and you need to find someone that is a fit for you, because if they're not a fit, you are not going to open up. All right. Hope this helps. Hope it clarifies some things. I am going to do a longer video like this as well on the difference between mental health, mental illness, and mental health disorders or mental health issues. I get asked that all the time as well, so I'm going to do differences of those two. Okay, you know the drill. Take care of you.